Hello guys, welcome back to a new video. Today I kind of wanted to talk about what a shift looks like in my 12-hour days. What does it really look like? What is it that I do? I just hope that this can be helpful. I know I usually do like little vlogs to kind of, talk about my shifts, but it's very hard because I'm always doing something throughout the day. So I kind of just want to talk about like how it is, what I do in my 12 hours. I do work day shift, so I work from 7 in the morning till 7, but it goes out to 7:30 for a report for the oncoming shift. So when I get to work, I go in and I clock in at the clock station. So I clock in, I go over to our like staff room that we have, our break room. I put my lunch bag away, I go over to the locker room, I put my keys and my belongings, jacket, whatever I have on me in my locker, grab my stethoscope, a pen, and then I head over to the nurses station. At the nurses station, that's where we keep our nurses assignments. So basically it will have all the nurses that are on for the day and all the CNAs that are on for the day, and there'll be numbers next to those names. So it'll say Celeste, 1, 2, 3, 4. Those are my patients. Then I grab my report sheet, and then on my report sheet, I write down what room numbers I have. Once I've done that, then I'll go and find a spot to sit at. Our unit is pretty spread out. We have like a nurses station over here, and then we have a hallway and a nurses station over here. And the room numbers start 1, 2, 3, 4, 5, all the way up to 46 on this end. So depending on where my rooms are at, I either sit at that end of the station or at the other end. That way I'm closest to my rooms. Once I find my spot, I log into my patient's charts. I'll look up, the basic stuff, their name, their name, their age, full code, DNR. And I try to gather as much as I can from the chart, what medications they're getting, what they're here for, are they taking any pain meds, anything that I can physically see and gather in the chart, I will do that. 7 a.m. hits, I start getting the nighttime nurses come and then start telling me report. So when the nurses give me report, I mainly want those things that I can't see from the chart myself. So like orientation, how do they take their pills, how do they move, do they use walkers or canes, any specific things that are not being shown, I'll add on to my report sheet. But for the most part on that report sheet, I've already gathered all the stuff from the chart. It's just kind of, you get to know a little bit more like their personality or things like that, which is not like you need to know that, but you get a little bit more of a profile on that patient when you talk to the nurse. After I'm done getting report and I've asked my questions on the patients, I go back into Epic. We use Epic, that's the electric medical record that we use. But I go back in and then I look at my patients, I look at orders. I do not just trust what the last nurse tells me. I myself check everything. Are they on continuous fluids and they didn't tell me that they missed it? So I double check everything. I look at all the orders, I look at medications, their IVs. Sometimes they'll be documented that they have 2 IVs, they really only have 1 IV or vice versa, things like that. Things do get missed, and once I've gathered all the information I can from the record and I've gotten report from the nurses, I then go into my patient's rooms. We have our whiteboard in the room, which we write the patient's name, what day it is, who their nurse is, who the CNA is, what their diet is, who their doctor is, how they ambulate. And then there's like another section that's the plan of care. So what does their plan look like? What are we treating them? How are we treating them? Are we giving IV antibiotics? Are we giving them fluids? So I'll tend to go in there, introduce myself. I'll say, hi, my name is Celeste. I'm going to be your nurse today. I am here until 7. And this is going to be your CNA. Your nurse is going to be Dr. ABC. And this is what our plan is. We're giving you antibiotics for pneumonia. We're gonna give you a little bit of fluids because you have an acute kidney injury. And it looks like we're also gonna be doing a chest x-ray later on to check your lungs. And we'll be needing a sputum sample to check for the pneumonia, what kind of bacteria there is. So that's essentially what I'll tell them. I'll tell them, here's your call light. If you need anything, if you need me, your nurse, for any pain medicines, if you need a CNA, for whatever, you can call us with this call light here. And if we can't get to it, somebody else will. I like to kind of lay it all out from the very beginning because it really does help them feel like they can trust us, and it also will decrease call light use if you're checking on your patients hourly, which is what I try to do. So that's what I do at the beginning of the shift. Once I've gathered my stuff, I check into all my rooms. I make sure they have all their stuff. They have their side table, they have their urinal, they have their call light, anything they might need, fresh water, things like that. I also use this time to ask them if they're having pain. So when I go in to take their pain medicines, I can bring that along with me. And I'll check all the tubing. I'll check their IVs while I'm in there. And that way I know what I will need for when I come in next. And I like to tidy up their rooms too. A lot of the times their rooms are very messy, and most of the time it's not them making that mess, it's the caregivers. And so I like to tidy up all the stuff, make sure we don't have extra of all this, linen and this, because you guys know that things add up in the room. So keeping it tidy. Sorry, I'm out of breath. I'm just talking so much. But that's what I'll do. I'll go back out. By this point, I have written on a sticky note who my CNAs are and their numbers, so I know what their number is if I need them. And then I'll write another sticky note, and I'll just stick it to my name badge. So a sticky on my name badge with the CNAs, what rooms they have, their number. And then on top of that sticky note, I stick another sticky, and I put the order of what patients I'm gonna see first based off their needs and things like that. So then I'll go into the med room. I'll go to, say I wanna go to this patient first. I grab their medications, I grab any antibiotics, any fluids, any new tubing that I need, grab their medications, and grab flushes, put those in my bag. I grab alcohol pads, caps, all the supplies that I'll be needing for when I am in the rooms. So then I go into my patient's room. I'll start with patient, say room 1. At this point, I've already introduced myself because I've already been in there once. They know who I am. I'm coming in to bring their medications. I go over their medications. I ask if they have any questions about them. I educate them on why it is that we're giving this, and then I proceed to give their medications. After giving their medications, like pills, I'll do their IV meds, or I'll do their injection medications as well. I'll then do a head-to-toe assessment. I like to do it with my med pass. That way I do it all in that one visit with the patient, and it's early on in the shift. So, I'll ask all the questions, orientation questions, and letting them know that it's important to get up to their chair for all of their meals. And so I'll do my head to toe, get them up into their chair for breakfast if needed, if they're not already in their chair, making sure again that they have all their stuff, that call lights are on, all the safety checks, bed low, everything close to them that they need. From there, I do that for room 2, 3, 4, and sometimes 5 patients. So I do that for all the patients. At this point, I've been passing medications from 8 in the morning to 10 a.m. So about 2 hours of just passing meds, doing assessments, giving them the things that they need, helping them to the bathroom during all this time. So after that, I go back to the nurse's station and I will do my charting on the patients. Since it is day, I technically will do all my assessments after I've done my pass my meds and my assessments, then I go and chart. I do not chart it in the room because, guys, let's be real, that's not realistic, at least in day shift. But yes, I'll go back to nurse station, do all my charting. Once my charting is complete, I will go on a mini break, go to the bathroom, do those things. By this point, it is, 10:30, 11. During this time, the patients don't really have any medications. There might be some procedures going on, where I need to say patient's gonna go get an MRI, so I'll need to get them up to the wheelchair, and MRI will come and get them, and so forth. But I look over my patient's vitals, check how they're doing. Is there any change of status in any of my patients? If so, I would have reached out to the doctor, letting them know, hey, blood pressure is this, hey, their orientation is this. Just following up, things like that. Talking with case management, what's the plan for this patient? When is this patient leaving? Or if I have discharges early in the morning, this time would be the time for getting that patient dressed and ready, taking their IV out, giving them their discharge paperwork, going over their medicines that they're going to be prescribed, making sure they follow up with their doctor. And also in that meantime, talking to the doctors when they reach out to you for new things or questions about the patients, if I've noticed certain things about their presentation. So sometimes as well, new orders will be popping in for patients. This patient's starting a new antibiotic. This patient's gonna get Lasix to be diuresed. So it's all care coordinating at the start of your shift to the end, with doctors, with respiratory therapists, with physical therapy, occupational therapy. You'll be getting calls from all these people on the care team. Can I go see the patient? How's the patient doing? Do they use their walker? During this time, I'm coordinating with everybody on the healthcare team because I am getting calls on the phone about my patients, about things that need to be done. I am also addressing any new changes, like I've said. If a patient has chest pain, I go in and assess the patient, listen to their heart. I look at their medications. I take their vitals. I call either like a rapid response, or I let the doctor know. I give nitroglycerin to help with chest pain, or sometimes it's more like GERD anti-reflex, but it feels like chest pain, but it's actually not cardiac related. So just different things like that. Or throughout the day, you're fighting, someone has nausea, so you're fighting the nausea, or someone has really bad pain, so I'm giving pain meds as needed, nausea meds as needed, or someone's constipated and I'm trying to get them to go. So having them go on walks, giving them bowel meds, giving them fluids, doing whatever it is that I can for each patient. And so it's just like each patient has their own care plan, their own thing that we have a goal towards. And so just working on each patient like that throughout the day. That is the majority of what the day looks like until about 2 o'clock is when I start having kind of like a little mini med pass. I'll have more medications to give that are scheduled. And then as well as if like my patients are diabetic, I'll do blood sugars. I forgot to say, right about lunchtime, 11:30. Patients will get their trays. I'll make sure they're in their chairs. I'll make sure 12 o'clock vitals are done. And I'll go to lunch. And then again, I'll take a little break for that, come back. And like I said, at 2, I usually have some meds to give. From there, 4:30 is like the next time where we do blood sugars again for dinner. Again, talking with the care team, a respiratory therapist, physical therapist, occupational therapist. This is all going on throughout from morning all the way till this time still. I'm doing wound care changes if patients have wounds on their legs that need to be changed. Maybe a patient has a PICC line dressing that needs to be changed, or they need lab draws, or there's just a lot of different things. And it's like every day is different because every patient is different and has different things going on. So it just really depends on the day. Some days you don't have a whole lot going on, some days you do. Also making sure that my patients are peeing and pooping. If they're not peeing, what do we need to do? Bladder scan, see how much is in their bladder. Are they retaining? Do we need to put a Foley in? So these are all things going on, and they're all happening simultaneously. I can have a patient having chest pain, a patient that's not peeing, a patient that just had a code brown, and a patient that needs to go to MRI. These things could all be happening at the same time, and you got to think, what is most important? Which patient do I see first? And so that's kind of like what the day is like. It's not like one task then another task. It usually will be like, reminds me of that like whack-a-mole, like all these little, you know, things popping up. It's literally like that, and just learning to know which patient to go see, because you can't do it all at the same time, but you do need to do it all. And that's why you have your help as your CNAs and your charge nurses and other nurses that are willing to help. But that's literally what my day is usually like. I'm trying to be as detailed as possible as to the things that I do, but I feel like that is all I can really think of as of right now. But once dinner is over, we'll go back into my patient's room, pick up their trays, chart their trays, how much they've eaten, and throughout the day I'm charting like their safety rounds as I check on them, if I've gotten them water, if they finished something, they got them a snack, if I did a Foley on them, if I put a new IV in. All these things are being charted throughout the day. And so then in the evening, I make sure that all their education is charted, their whole care plan is charted. I'll write any notes that need to be written. And then 7 p.m. will hit, and I'll give report to all of the night nurses that have my patients. From there on, at this point, it's 7:30. So I will log out of the computer. I'll get rid of my report sheet in the HIPAA shred bucket, and then go to locker room, grab my stuff, put my work stuff away in my locker, and then I'll walk down, clock out, and that's my day. That's what my day consists of. So hopefully this is helpful and hopefully gives you a little bit more of an idea of what goes on and what kind of things we do. It's a lot of caring with everybody on the healthcare team, advocating for your patients, things that they need, medications that are not ordered but they usually get, or sometimes those things are not ordered for a specific reason because of what they're there for. So it's a collaboration, the nurse having to, you know, coordinate all this different care. So thank you guys for watching, and stay tuned for the next one.